All right, moving on to the next arm of the immune system are phagocyte disorders. There are a host of congenital neutropenias, including Kostman syndrome, severe chronic neutropenia, and cyclic neutropenia. There's chemotaxic defects such as LAD or leukocyte adhesion defect. And there's also killing defects like hyper IgE syndrome, Shiraya-Higashi, chronic granulomatous disease, and specific granule deficiency. And we'll talk about each one. All right, let's start with the neutropenias. All right, Kostman syndrome is autosomal recessive. It's due to a mutation in the HAX1 gene. And these kids are just basically present with, opportunistic infections due to neutropenia. There's also severe chronic neutropenia. This is autosomal dominant, and it's due to a mutation in something called neutrophil elastase. And there's something called cyclic neutropenia, where every 3 weeks to 6 weeks, they have these cycles of neutrophil levels. And this is also due to mutation in neutrophil elastase. And these patients, when they reach their neutrophil nadir, they'll develop some of the opportunistic infections. Now, phagocyte chemotaxis disorders, there's LAD1 and LAD2, extremely rare, but the board really loves this question, all right? And what happens in these patients is that there is a defect in something called CD18. It's an adhesion molecule. It allows for neutrophils to kind of roll and stop and then migrate to the area of infection. So when you have this present, these neutrophils can't go to where they're supposed to go to. And so you have this infection that's called a sterile abscess because there's no neutrophils present, okay? You get this pronounced leukocytosis because the bone marrow is sensing that there's an infection present, but nothing's being done about it, so it just cranks out more and more neutrophils and leukocytes, okay? And you always hear this a lot. These patients will get delayed separation of the umbilical cord, so anytime you have that, you want to think about LAD. But more often than not, they'll get more severe symptoms, like they'll get really bad gingivitis, umphalitis, failure to thrive. Now, there's also a type 2, which is extremely rare. This is a defect in fucosylation of the Sal-Lewis moiety. Basically, it involves the rolling of neutrophils, and if they can't slow down and roll, they can't get to where they're supposed to go to, and you have similar sequelae. In addition, these patients will also have sort of abnormal phases, poor growth, mental retardation, and again, the sterile abscesses. Okay. Now we'll talk about some of the phagocyte killing defects. Right. Job syndrome or hyper IgE syndrome, okay, is the name. It's also called Buckley-Job syndrome. And where the name comes from is from the biblical character, Job, who was sort of smitten by Satan and was cursed with all these boils all over his body. And so that's where the name comes from, is that. These patients have abscesses and boils all over their body. The IgE is usually elevated, though not required, so it's kind of a misnomer that it's called a hyper IgE syndrome. In addition to the abscesses that I talked about, they also have scoliosis, hyperextensibility, delayed eruption of primary teeth, fractures, pneumatocysts, and coarse facies as well, too. Okay. Shiraya-Higashi. This is caused by impaired lysosome degranulation. This is autosomal recessive. These patients have partial occicutaneous albinism, and they also get cutaneous and sinopulmonary infection. So if you have, someone who a vignette with, some partial albinism, recurrent infections, think about Shiraya-Higashi. Unfortunately, they also have mental retardation and a progressive peripheral neuropathy that's not amenable to bone marrow transplantation. Now, the key here is if you do a peripheral smear, you'll see giant granules. So you get that vignette with albinism, recurrent infections, and giant granules is Shiraya-Higashi.